Through the course of my career, I've seen major changes happen in psychiatry. The biggest change that happened was that psychiatrists stopped being therapists by and large. And now the training in psychiatry focuses on medication and diagnosis, but not on psychotherapy. Sometimes psychotherapy is added as a side issue, perhaps, but that's not the major thing, as it was before. As a result, then, the psychiatrists have become pill pushers. They've relied entirely on medication. And they've had so many medications come through. And they have been sold on so many medications by the pharmaceutical industry that they keep being taken for a ride time after time, because what they are told about the effect of medication, that what they see in the selected studies that are published, make them believe that this medication is doing something important for the person. Now, I don't dismiss the fact that, yes, some medications sometimes do something important. But I also want to make the point that it's not just the side effects of these powerful medications that's the problem. It's not just what we know about what people suffer from taking these major neuroleptics. That's the problem. The problem is that some of them work pretty well. And when medication works pretty well for symptoms of trauma, a person is not going to be diagnosed as having trauma. When medications work well, the person themselves will be feeling better from the medications. But that does not cure trauma. Feeling better doesn't cure trauma. Many treatments that we use in the field today in psychotherapy are treatments that try to help people feel better, to help them become more resilient, to help them cope better despite their post-traumatic condition. And when they succeed in coping better, then too often people make do with that, and that's not good enough. It's not good enough for people because trauma is so treatable that there's no reason in the world why a person should go on having even minimal symptoms from a past trauma. Our work, we see this, not only is it so treatable, it's easily treatable. If people can be treated for complicated post-traumatic conditions in 2 weeks. Of course, this marathon treatment in 2 weeks is very different from what we get in usual conventional psychotherapy, but trauma responds to that treatment. And many people are going along on medications that made them feel better. And the side effects are terrible. And their lives are compromised. And it's not necessary. Well, almost everyone that comes to us has been referred because they weren't making progress in therapy, or have been referred because they have been treated to the utmost with the capacities, medications before they come. So almost everyone who comes to us is on medications. Well, we can't take time, and we don't make it a part of our intake process to get people off of medication, but we have them go right over the medications they're taking. We don't make any change, if possible, during the course of the treatment. At the end of the treatment, most people come to understand that the medications are not doing what was done in this treatment experience. And they understand that the medications are not going to produce the kind of relief that they want and that they're getting otherwise in the treatment. So people usually are very ready to go back to their doctors and to be put on a program of withdrawal from the medications, gradual withdrawal, because these medications can't be stopped all at once by and large.